Our team, welcome back to Plastic Surgery Untold. I'm Dr. Johnny Franco, also known as Austin Plastic Surgeon. And so we have our celebrity cast with us today. We got one celebrity anesthesia.
Hey guys, what's up?
We got the Austin's most beautiful man, Gilberto.
Buenas tardes.
And then we have the privilege of having Sarah, who's a lifestyle blogger and influencer. You can follow her at Delivering Motherhood. She is not only a lifestyle blogger influencer, but you're also an OB nurse as well.
That's right. Hey guys, happy to be here.
Which I think is super exciting. And one of the reasons we had her on is that this is kind of, she sees this from two angles, from one being a nurse and the other part is just from her lifestyle blogging that she does on I guess sort of your second, third, probably fourth job, because you're a mother as well.
Right. Yeah. I can't stay busy enough, basically.
Tell us a little bit about you, because we actually kind of met online doing a lot of, as you and I both being influencers, we're trying to get Celebrity and Gilberto to become influencers like ourselves. But at our Celebrity, Influencers Club, we met once and have become friends since then. And so tell us a little bit about you and what your blog talks about.
So I am a born and raised Austinite. So I'm a mom of 3
Ooh, you're like one of the 5 left.
Exactly. One of the very rare. So I like to slip that in there. I was actually born here and haven't left, which is obvious why. And then I have 3 girls. I'm a twin mom. So I've got twins that are 5. I have a 2-year-old. And then, like you mentioned, I'm an OB nurse. So I get to help deliver babies for a living. And then we're almost a week out. So I just had breast augmentation surgery, which is kind of what we're covering today. So yeah, kind of the hot topic of the day.
So you got the trifecta there, because you see people starting their lives. You also influence people because you basically share a lot of your life with people. Because as we were talking about earlier, I follow you online. I watch some really cool stuff that you guys do. You do a pretty uncensored version of stuff. One of the things that I thought was absolutely hilarious, and for people that don't know, Celebrity's wife is actually a fashion blogger, if you will. So you guys have a lot of competition in common. And as most people probably don't know, you guys are actually a little bit of rivals. And one of the things that I thought was so funny is that your husband and Celebrity were exactly the same, because when you came by the office, he was taking 1,000 pictures. You only scolded him 3 times, saying that's not a good angle, which I thought was hilarious.
Yes.
And then we were taking a picture and you're like, that's not my good side. And we had to switch sides to make you happy, but that's cool. And I was like, oh, I wanted to put like Celebrity on FaceTime just so he could see that he's not alone in the world.
I'm not the only one suffering.
Yes.
Maybe you guys should start like a celebrity husband, like support group.
Oh, I'm open to that.
I already mentioned this to Dusty, and he's convinced that he is the best husband photographer, but
damn.
I'm sure he would
Celebrity
be open.
husband. What do you think about that?
Shots fired.
We may have
to have a celebrity husband off.
That would be kind of Sarah, can we arrange this? Can we figure something out and we'll do a little Instagram competition between celebrity husbands? Can we?
We need to, maybe like an Instagram live. I mean, Travis, as long as you take at least 27 photos every time.
Oh,
we need a lot to work with. That's
at minimum.
I don't want to give away I don't want to give away the challenges yet, because this needs to be a surprise. What we need to do is, between you, me, and Gilberto, we need to come up with 3 challenges that are unknown to the celebrity husbands, and then we'll pick a weekend day, and we're gonna have like a little celebrity husband challenge off.
It'll be like a little celebrity husband decathlon.
Ooh, I like this. I like this. So
perfect.
some exciting things to come. Well, let's catch up a little bit what everybody's been doing since last week's podcast. Sarah got some new titties. Gilberto, anything you you got going on? Some new calves? Anything?
No new calves. Just been going to the park a lot, just trying to get outside a little bit. It's starting to get a little warmer, so trying to enjoy the outdoors, but not melt in this incredible heat that we've been experiencing.
You've been working on your tan or anything?
No, I'm in dermatology, John. I have to wear my sunscreen every day. So no, I'm not working on my tan.
Okay. Celebrity husband, anything besides doing some anesthesia, keeping people comfortable?
Keeping people comfortable. Outside of the OR, we've been working a lot, as you know, and everybody in the plastics world
Just to put that in
has.
perspective, you just came back from a vacation last weekend.
Okay,
right?
I knew that was coming. Yes, I did.
I
But
just,
before I was out of town, we were working quite a bit. We have a backlog of cases at the surgery center, and we're pumping them out. We're trying to get everything done as much as we can. So
all of you that haven't been able to get on the schedule yet, please direct all your messages to your trendy therapist, celebrity anesthesiast, personal admin.
Yeah. Outside of the OR, I'm still training for the half marathon. So I've been doing that. Mary is finally at your trendy therapist. That's my wife. Shameless wife plug number 9076. She is actually hopping on the bike now. So she is riding around with me for the runs. So that's been fun.
Can we organize like a big group outing to do? Because at CODA, you can take your bike out and ride around CODA. So
Let's do it.
Maybe when Sarah's healed, can we get a big group out and do maybe we could do a little fundraiser or something and do a bike-a-thon around CODA?
I like it. Let's do it.
They do it on Tuesday nights.
Tuesday nights. Are you allowed to come out on Tuesdays?
I used to ride my bike out there when I was training for a triathlon.
Very cool.
Well, let's jump into it. This episode is going to be talking about Gummy Bear Implants, because I think one of the hardest part of breast augmentation is deciding what implants, what kind of implants, and what size. And so we can talk about all that, focusing on the actual implants themselves. The anesthesia part is easy because of people like Celebrity Anesthesia. And we'll circle back to that, and he'll remind us some of the stuff he's talked about on episode number 6 of anesthesia and the ERAS protocol, and some of those things that we've accomplished in terms of making recovery a little bit easier. But one of the most common questions we get is what breast implant should I get? And then to follow that up is, what is a Gummy Bear implant? And Sarah, talk to me a little bit your thoughts of trying to decide what implants and questions you had in your mind. And maybe we'll kind of go through that process a little bit to walk people through how you kind of came to a decision.
Yeah, absolutely. Being a nurse, I feel like I automatically was thinking, well, what's the safest for my body? Health conscious. I have heard in the past, maybe saline is safer. You might think that just because it's salt, basically like salt water. But then I knew just from watching a lot of what you've already put out there that the Gummy Bear implant, being the highly cohesive gel, you can get a more natural look than the saline, but having a safer implant, and you'll be able to explain this better than I can, but to where even if something were to happen to the implant, somehow it broke or ruptured, it still stays in one spot. So you don't have to worry about it kind of leaking out all through your body. So yeah, just kind of watching what you had put out there and asking, questions with you at our pre-op consult, I was able to realize that was the best way to go.
And that's honestly one of the things that's been a little harder for us is we used to have every implant under the sun out on just display for everybody to touch, feel. We had them in our waiting room. We had them in our exam room. We've had them, in our coordinator's office. And we've started to limit it a little bit just because, obviously for patient safety, we want to make sure that things aren't being touched by a million people. But no question, when you can feel the difference between a saline and Gummy Bear, and you can really tell the difference. And to your point, Gummy Bear is not a true brand. It's not a true thing. It's a nickname that the implants came to, because when you cut the implant in half, it looks like a Gummy Bear candy. And that's where the nickname came from. And so it's kind of interesting. But to your point, the fear was in the past was if the implant was to rupture, like a saline implant, it would just deflate. You got a flat tire on one side. It's salt water. Your body absorbs it. Kind of the end of it. With the gel, the silicone, is still there. I think one thing that a lot of people forget in terms of safety is even saline implants, the shell of the implant itself is a silicone shell. So it's not like you're not having anything inside at all. And I'm going to try and show you guys here. So for those of you that that don't follow us on YouTube as well, if you want to see what I'm talking about, you can jump on here. But I've got a saline implant here. And so, one of the things that's kind of cool is the saline implants always tend to have a little bit more firmness. And if you could hear me drop that, I mean, that felt like a rock, where, the little feather of this gel implant is much, much softer. Because with the Gummy Bear implants, I always like to say you can get fullness without firmness. And I think that's a super cool entity, because especially for our moms, most of the time, you can correct me if I'm speaking out of turn here, Sarah, but a lot of moms want to restore the fullness that they had. They're not necessarily looking to porn star it up, but they also don't want to feel so deflated. They just want to get back to where they were. Or a lot of moms actually like some of the fullness that they had when they were pregnant and gorged during breastfeeding and some of those things.
Yes. Absolutely. After breastfeeding all three of the girls, I knew I needed some help. And I've seen you hold up the Gummy Bear implant, like kind of sideways.
Not the one I dropped.
Is that the one you dropped? No, that one.
I dropped the saline. That's why you heard the thud.
But when you hold it up sideways, it's like, it just looks a lot more natural. Yeah, just like that. So, yeah, it's the way to go. It doesn't feel like you have a water balloon, up in your boobs. So I love it.
And even from the head of the bed, I think Celebrity, you've made comments a lot. The difference between the saline sizer, the gummy bears, just some of that nice natural slope, because the gummy bears are so much more compressible. When we put them under the muscle, you don't see as much of that overly round coconut type look. And being at the head, a captain of our ship here, you see that all the time.
Absolutely. And for those of you guys the three people that exist in America that don't watch your stories every day, when we're in the OR and we sit patients up and we insert a saline sizer, and we actually fill it up with air just because it saves time during the case, but we will fill it up with air, and it basically takes the same shape as that saline sizer, and it actually looks much more augmented, much more fake, much less round and smooth. But when we actually put in the real silicone implant, it looks much less dramatic. It's got a much more natural and smooth shape.
And I think Sarah brought up, basically there's different types of silicone implants. And so there's the highly cohesive, which is what we'd call the 5th generation of implants. And most of the implant companies are actually moving to that. So I think in the next 4 or 5 years, you won't even have an option of doing a silicone implant that's not a type or gummy bear type implant. And it's pretty interesting, because when everybody, and one of the things that kind of makes it better and better for patients is each company tries to one up each other, right? Because everybody wants something a little bit better. So now there's even different degrees of gummy bear implants, right? So there's like the highly cohesive, and then there's like highly cohesive plus. And so, then Allergan thought that wasn't enough to have 2 choices. So they have 3 levels of cohesive gel. And so it's kind of interesting how things evolve, and in the end keeps giving patients more and more options, which I think is a plus when there's competitiveness to get better. Much like Gilberto and Celebrity Husband have a competition of who does the best quote of the day. And our quotes have gotten progressively better, I would think.
It's the innovation in competition.
So some of the other benefits, and not so true sometimes for some of our younger moms or 20-year-olds, but definitely some of our older patients. One of the other reasons that we switch out a lot of saline implants to the gummy bear implants is something we call rippling. And I don't know if you saw this on your research, Sarah, and those who are watching on YouTube, you can see this. Those that are listening, I'll try and explain it. But you can see here, I'm holding up a saline implant. You can see the edges, and the rippling is basically where the water balloon basically turns the corner, and you could just see the edges of that. And in the old days, one of the things that people used to do to decrease that rippling in the saline implant was overfill it. So if you had a 420 cc implant, they may put 440, 450 cc's in there. The trade-off obviously is just like any water balloon that you overly fill. The more you fill it, the harder it becomes. And that's what gave some of the people that overfilled, round, fake, hard look that I think scares a lot of people from getting their breast augmentation, is because they just don't want to be overly fake. They still want to be able to do the PTA meetings. They still want to do I think somebody told me she was the head of the, what's it called when you pick everybody up, all the kids from school? You can tell I don't have kids.
Like the buses?
No,
I don't know.
no, but no,
Carpool?
the moms drive the bus
Oh,
now.
the carpool.
The carpool.
There we go.
Sarah, I can tell you got your pulse on the
Yeah,
on the
I'm not the
carpool.
head of the carpool.
She said
I'm
she was
not.
head of the carpool, so she said she couldn't look overly fake picking up all the kids. So I thought that was priceless.
Yeah, I actually had somebody direct message me when I started talking about that I was doing this, and they asked specifically about the type of implant, and their main concern was the rippling. So that must be something that's more well known with the saline, and why we're obviously getting away from that.
I think and celebrity, and you do a lot of because the majority of the cases that you do are for plastic surgeons, and so you've probably seen a lot of that over the last couple of years of switching from saline to silicone implants.
I would say it's less than 5% of the breast dogs that we do are putting in saline implants at this point.
But you see a lot of people taking salines out and replacing them.
See a lot of breast exchanges or implant exchanges are going from saline because they either have rippling or they don't like that look of being extremely round and not soft, and then they transition to a much softer, better gel implant.
Gilberto, thoughts you have about the new Gummy Bear implants in as we used to operate a lot together?
Yeah, no, I think the science is really interesting behind it. Clearly it's the wave of the future, and it does give a more natural outcome to the appearance of the breast. On a personal note, you did the surgery on my girlfriend a few years back, and she had the same Gummy Bear implants placed at the time. So, I've seen what they look like, both from the assisting surgical side and from the other side of the equation. So, yeah, I think it's they're really impressive.
There's so many things I want to say right now, but celebrity keeps shaking his head no at me, so I'm gonna pass because celebrity is giving me the devil stare of don't do it right now. So you do have an ally, even though you guys are quote rivals.
Quote rivals.
Quote rivals. Okay.
But I think the other thing that's kind of cool about the gummy bears, and this is definitely a misnomer, and I actually saw this on TV probably about a month or two ago, where there's just a misunderstanding because for some reason people think gummy bear breast implants have to come in shaped implants and that they don't have them in round, and that is just not true.
Right.
And I think Gilbert, you've seen them. Travis, you see them all the time. Sarah, you've seen them in our office and felt them. And so I think that misnomer came because the very first gummy bear implants were a shaped implant, and that was what first came out when I was actually in residency back in like 2005. Right before silicone came onto the market as a whole, because as most people know, with any kind of FDA approved device, they're through in trials for a long time before they actually come onto the market. And so the very first gummy bear implant was a textured shaped implant. But it's not true anymore that's the only gummy bear implant on the market anymore. And just something I think that's important, because some of the bad press came from textured implants, and sometimes when we hear gummy bear, people think that the implants have to be textured. Do you guys mind if we touch a little bit on that, since it made so much news and so forth? And I don't know if you guys had ever saw that. I know you guys are busy celebrities traveling the world, and Gilberto, ridding the world of skin cancers and making some luscious lips. I don't know if you have time for TV.
No, I remember hearing about this. Yeah, let's talk about it.
Because one of the things that was on the news, one of the companies did recall their textured implants, and shaped implants are typically textured because that's what keeps them from shifting and moving. I think most people don't realize that textured shaped actually make up about less than 5% of the implants in the United States as a whole. Anyway, the smooth round implants is the #1 implant in the United States for probably the last 10, 15 years. Probably farther back than that, but I'm not that old. But over my career, it's always been the #1 implant used. And so it's a very small percentage of implants. And the idea is that that there was some Velcro action, and then that friction was causing something called ALCL, a low-grade lymphoma, and so that's why they got pulled off the market. But the majority of the implants are smooth implants, and that's what we continue to use. And so that's the idea, and hopefully that makes sense.
Yeah, absolutely. Want to make sure that patients are safe and well educated.
Go ahead, Sarah.
I have a girlfriend that did it must have been one of the very first gummy bears, because it was shaped, it probably was textured, I'm not certain, but it sounds like it was, and it ended up flipping, and she switched to the same kind that I have now. She got them taken out, replaced, went to the smooth round. It sounds like it was it was about 10 years ago, so it must have been one of the very first ones.
And that's one of the reasons that and I think the shaped, have a much bigger role in breast reconstruction and those type of things. I think in the aesthetic breast dog, they tend to have been a little less common for a couple reasons. One, if they shifted, moved, then people needed to be revised, and that can be more out of pocket costs, which can be hard for patients. Two, there was actually a great study that was done, and they looked at 100 patients, half of which had the teardrop shaped implants and half that had the smooth round new Gummy Bear cohesive gel. Okay. And this was all judged by plastic surgeons. What percentage of the time do you think the plastic surgeons could choose which implant they had?
I'm going to say.
And this was plastic surgeons evaluating these pictures.
Like 80%?
50% of the time.
Okay, I was thinking probably pretty easily.
No, they couldn't tell. So 50%.
Wow.
So 50% means that you were guessing.
You were guessing, yeah, one or the other.
At that point. And some of that comes to the point that Celebrity brought up earlier with the new gels, how, especially if they're under the muscle and they get compressed, they already have that teardrop. And you can, for those of you following us on YouTube, you can already see, how that gives a compressed look, and that already has a teardrop, and standing up is in that natural position that most women are going to be in, for the majority of the day when people are seeing them into that type of look. And then the nice thing is, because one of the things that we talked about in the office here was finding this realm where you can dress them up, dress them down. And I feel like with the new Gummy Bear implants, that range is a little bit bigger because, again, you can get some fullness without firmness. And I thought about that this morning and as I was exercising, and that's going to be my new term for the week: fullness without firmness.
That describes it perfectly. Yeah, absolutely. I wanted, if I want to.
So if you notice, Celebrity nor Gilberto are willing to give me a compliment on that great line, but they're stingy, so that's cool.
There's so many things I want to say right now.
Same.
Fullness without firmness.
Trying to keep this PG.
I'll give it to you.
Sarah, as we continue our dual podcast here, go ahead and please continue.
I don't know. Now I got off track.
You were talking about fullness without firmness?
Yes. Oh, yeah. Well, we were talking about sizing in the office, and just like what you said, dress them up or dress them down. I can feel sexy in a swimsuit, or I can feel professional at work, without having to change anything. Literally,
which is important if you're driving the carpool.
Exactly. Yeah. Or I'm your nurse. That's not. Oh, that could go.
Well, I think plastic surgery nurses may be outside of that because. I think that's a little bit of a different category.
You're right. Yep, that could go the wrong way too. All right.
No, I do totally agree with you, Franco, on that. I mean, it is a much softer, much more full look without giving you that overly projecting, super round, in your face, Baywatch, Pamela Anderson, 1990s kind of look. And that really, it does allow you to dress them up and dress them down, like you said, because you're not stuck in that high, tight position 24/7.
Right.
And the other kind of cool thing about the Gummy Bear implants now is that they come in all sorts of different sizes and profiles. So, there's a couple different ways that we get to what's the right implant for each person. And so, and Sarah can jump in here anytime she wants, but we actually do a sizing system in the office. And I think wish pictures are great because it gives me an idea of what, terms like natural, full, subtle, mean a lot of things to a lot of people. And Gilberto could be all over the map with what natural is to him. But for the rest of us, you know, it's usually in more of a moderate range. But you wouldn't be surprised at what people bring in as natural. And so make sure that we have the same reference point, because there's times people bring in a picture and they'll have a size that they're sizing on that they like. They bring the picture. I'm like, hey, those are both nice, but they ain't the same.
Yes, I will say that that was recommended to me, to bring some pictures of something that I like, something that I don't like. And I think that was maybe the number one most helpful thing, other than actually trying them on, because your input, I was really appreciative, and that helped me decide. We were picking between 3 different sizes. You knew what I wanted to look like in the end. And of course, we're talking about different, you know, a different amount of volume or cc's, and everybody's starting with a different amount, right, in their tissue. So if I bring in a picture of this is kind of what I want to look like in the end, then you were really able to tell me, and as we were trying on the different sizes, this is probably where you want to be.
Mm-hmm. And I love trying on the implants themselves, because, you know, a 300cc implant on you, on Gilberto, on Celebrity Husband, you know, it's going to be different on everybody. And so
Yeah,
it gives you a real feel for what it's going to look like.
yeah, and that's the fun part.
It is the fun part. It's like, I tell people, it's like taking a test drive, you know, just take them for a stroll.
Well, I think
My husband kept telling everybody we went boob shopping this week. I'm like, we sure did.
that's great. I think
he's moving into husband number one. Is there a way, just like Gilberto lost the name Austin's Most Beautiful Man, is there a way that Travis could lose Celebrity Husband and
not a chance.
And Dusty could take that? I mean,
I
feel like we're on the
patented
fence right
that.
now of losing Celebrity Husband title.
I don't know.
Man.
I don't know.
I thought I lost Austin's Most Eligible Bachelor. Who said anything about losing Most Beautiful Man?
Greg took it. I think Gossip Greg took Most Beautiful Man. Huh?
Greg took Most Eligible Bachelor.
Maybe we need to refer to the video.
Which video is this? Are you having clandestine meetings with Greg?
Yeah. We've been talking about you. He's like, how can I dethrone Gilberto? But I like how you saved Celebrity Husband from losing his title. That's good. You guys are banding together today. What's going on?
That's right. And the quote artists have to stick together. No, I did want to point out one other thing, and Sarah, you can probably I think you'll agree with where I'm coming from here. I think people, when they come in, especially pre-op, and they haven't tried any implants on, they have this idea of CCs or a number in their head. And they say, oh, I want 350s. Oh, I want 400s. Oh, I want 500s. Mm-hmm. That means tons of different things to everybody. And once you see what a 350 looks like with the tissue that you already have in place, and depending on what profile you're going to go with, or base diameter or whatever, that changes the look completely.
Yeah, absolutely. I really didn't know until I tried them on. So like I said, that's the fun part. You get to go in the office, put them on with a little tank top, and see you're adding to what you already have, you know, and just see what works best for you.
Can I tell you my favorite, and I please don't take anybody that's listening who did this. I'm not trying to be rude, but my absolute favorite is when somebody comes to the office and says, I want the implant that's going to give me a C cup. And I'll be like, well, aren't you a D cup now? And they're like, yeah. And I was like, so we're going to put a C cup implant in and make you smaller with putting an implant. They're like, yeah. I'm like, okay.
That's not how this works.
I don't know how that works. Are we talking about, that doesn't add up.
Yeah, it happens. But I think to Celebrity's point, it's just that, you know, I think this is where a good consultation and spending a little bit of time is super, super helpful to make sure that we're on a good page about what we can or can't do. Because sometimes people bring in wish pictures and I'll just tell them, hey, I can't do that. You know, that's just not in our cards. And I think better to do that and be disappointed at the office than be, you know, disappointed $6,000 later, 6 weeks later, time off, hubby's time off, and et cetera, et cetera.
Absolutely.
What other, Sarah, if you could leave us with and not leave us because we still got a lot more show to go, but leave us on this segment. If you could leave 5 points for people who are thinking about breast augmentation and picking implants or the process, what are 5 little golden nuggets you could do? And if you can only come up with 3, we'll let Celebrity and Gilberto come up with 1 too.
Okay, perfect. I was like, oh man, 5. Okay, number one is do your research as far as picking your wish pictures. That I really do think that's most important. Have literally a physical photo of this is what I like and this is what I don't like, because I think that'll be super helpful for you. Another one is plan for your recovery. I think the best thing, I'm only a week out and everything's going great for me so far, but the best thing that I did was I set up time off work. I set up childcare. If you can plan to really rest and relax, then you're going to recover faster. And
Can
then
I put an
lastly,
asterisk by that? Because that's true not just for our breast dog patients, but any of our surgery patients. If you do a little time to give yourself a chance to recover, you're going to do so much better. We see people just sabotage themselves, and I'm like, please, please, please take a little time, and it'll save you and get you back in so much faster if you can just do a little time.
Yeah, and then the last thing that I'll say is I love, and I think we might talk about this later, but the medication regimen that y'all prescribe is awesome. And if you'll just stay on top of that, your pain is going to be so well controlled. And you're going to find that you don't even need that many narcotic pain medications. So just really staying on top of your medication schedule, your recovery is going to be so much easier and quicker too.
We'll circle back to that because we are going to come to anesthesia. And I think some of those are some great points, and Celebrity actually helped me come up with that regimen. So Celebrity, if you don't mind just holding on for one moment, and we'll circle back to that.
That's awesome to know that's going well for you.
Yeah, it's been a really good experience overall.
Great. Gilberto, any nuggets for our fans listening out there? All three of them?
I think one thing that is also important is, and I don't know how it is now, especially, given the way things are with COVID and restricting too many people in being in the office during consultations and such. But I think having somebody there to go with you, to listen for, certain points and such that maybe, you may not remember, you can have somebody there to be your backup essentially. And because there's a lot that goes on during these consultations, a lot of information that gets passed back and forth, and you may not catch everything, And so having someone else there, a second set of ears to kind of just catch all the information and then kind of tie it back to one another, I think is important. But again, I don't know how that works now, given the current situation of things. Has that changed much for you guys in the office?
It has a little bit. We only allow people to at most bring one guest. What we have seen a lot of people doing is FaceTiming or putting somebody on speakerphone so that they can listen. Sometimes they're just doing it from their car and so forth, or sometimes they're at home with the kids because they trade off. So 100%, you need somebody involved with that. So no, I agree. That's a great one.
Kind of to Sarah's point of planning for your procedure.
If I could piggyback on what Gilberto said there, having a caretaker lined up that's actually going to help you when you get home as well, and pick you up from the surgery center or be there at the end of your surgery, because we go over all the discharge instructions with them again, day of surgery when we're discharging the patient. So Sarah, was it your husband? I'm assuming that picked you up?
Yeah. Yep,
so,
absolutely.
We went over everything with Sarah's husband right after, and because, I'm married too, I totally get it. Everything's written down. I'm not going to be able to catch everything in that moment, but you want responsible ears and a responsible party there with you. That's going to help when you get home too.
And I'm the most responsive plastic surgeon in America.
You are. You absolutely are.
You heard that, folks. Call him day or night.
Yep, text him 1 a.m.
I want to say that my all-time record is 72 text messages during one surgery. We had some like 6-hour surgery, 72 text messages in a 6-hour period.
Wow.
So if I don't respond, you guys can hit me up again because I might have missed one of the 72. But
so you're saying you're really popular.
I mean, 68 of those were my mom asking why I had to call her back, but I didn't want to say that. But since you're going to call me out on the podcast, that's cool, Sarah. Appreciate it.
I'm just kidding.
Sarah, before we jump to anesthesia, and I really truly don't know the answer to this, so I'm not trying to do a plug for myself. How did you go about doing your research in terms of picking a plastic surgeon or doing some of that? Because that's something we've talked about a little bit on the show, and it's easy for Gilberto, Celebrity, and myself to be like, hey, you need to look people up, you need to do your research. But what did you truly do?
Okay, so naturally I used Google. I mean, I've Googled, and then being an influencer on Instagram, I spend a lot of time on Instagram. So I actually found you on Instagram. And then you put your surgeries obviously right out there. So I watched your, how you do everything. I'm not going to lie. I actually had my surgical techs that I work with. They watched y'all's surgery and they were like, he's really good. I really like how he does everything. So I was pretty thorough. I looked up all the reviews, and then I had people watch your surgeries, and, but yeah, really just the internet searches. You were easy to find on there. And then being all over Instagram, you're pretty active on there. So kind of a combo of all of those.
Kind of interesting to hear an OB nurse and surgical tech say that, because, we tend to be the most judgmental in our own field about skills and stuff. And it's funny because you never know what you remember from your training gets beaten into you. And I still remember our chairman, because he'd always be like, why is there blood in the field? He's like, what if somebody walks in, and this is the days before Instagram, right? He goes, what if one of the ortho guys walks in and he sees this mess? He goes, he'll be like, damn, this is worth an orthopedic case. He's like, you can't be that. You're a plastic surgeon. This has got to be pretty. And I will never forget that. That has been beat down. And so Gilberto and anyone who's been there knows that I'm like a blue towel king, because if there's one little spot there, I'd be like, no, we got to put a blue towel down. Can't have this mess in case somebody walks in.
Yeah. I think it looks like y'all do an impeccable job. So I was very impressed.
Let's talk about impressed. Let's go on to Celebrity Anesthesia, who impresses us every day with his skills and knowledge and quotes. So as we alluded to a few times here, and if you've listened to our podcast religiously, thank you. But Celebrity did help me come up with our ERAS protocol. As for those of you that don't know, he actually trained at Duke. And so I know some of you may not know that because you may have missed, all of our episodes. But he actually was part of the process where they first helped develop some of this. And so we've brought a lot of this into our practice. He was actually going to give a talk to all the plastic surgeons in Austin about ERAS and pain management. And because of COVID, that's been put on hold, but hopefully we'll get that done in the fall, because you were really, really willing to share that knowledge with everybody else in town, which is only to benefit patients.
Yeah, I'm a huge believer. I'm all in on the low narcotic train. I think that narcotics definitely have their place in surgery, and I use them when I need to. But anytime I can get by without having to give patients a ton of opioid-based pain medication, we really try to do that. So, and the way we've been successful with doing that is by doing using other pain alternatives besides just narcotic medications. We call that multimodal analgesia.
And I think the one thing to your point here is it's not like they're not getting anything, because sometimes people get scared that, I'm not going to get narcotics, I'm not going to get anything. That's not true, and that's not what we're doing. The idea is that at some point you get side effects from medications. The lower doses you do, typically the lower side effects that you're going to get. And so the idea is that you're doing a lot of things at low thresholds where they're not going to get to the side effects of a lot of these things.
That's very true. And there's tons of research coming out that's showing that preventing pain is not just hitting one single pathway, and opioids only hit one single pathway. So if we're able to use a handful of medications that happen to not be narcotics to hit a bunch of different pain pathways, we can help alleviate patients' pain a lot better. There are also a couple things that narcotics have in common, like increasing nausea profile, making people feel just crummy. There's also, there are several side effects. So if we can alleviate, and like Dr. Franco said, keep that number low or use less narcotics, we're winning.
No, I think, and then Sarah, I think basically touched on it earlier, but you also helped me with the protocol that patients do on their own, because there's the stuff you do behind the blue curtain, which
Yep.
I feel like is a segment we need to do coming up soon, but behind the blue curtain, because there's more behind the blue curtain than crossword puzzles and in video games.
And trading stocks, yeah. That's exactly right. We have a pre-op regimen of pain or medications that patients take preventatively, and then post-operatively we have another allotment of medications that patients are given in a time schedule to take them on that are not just narcotic medications, and they will help prolong that decreased pain time.
Because a lot of people, I'll tell you, the one of the biggest complaints we get, and I get it, because I've been at a pharmacy and it's extra money and everything else, but we do prescribe a lot of medications. And Sarah, as a nurse, I mean, you probably had two different gut feelings about this. Like, one, damn, this is a long list. But two, hopefully you like thought there was a rhyme and reason for it.
Yeah, absolutely. Actually, being a nurse, I am a big fan of medication, right? So I just know that it is helpful. And so I was excited to learn, you know, y'all have meds for muscular pain, meds for, you know, nerve pain, meds for inflammation and swelling. So we're covering several different pain points for you, you know, and then also the narcotics for just pain, regular pain, you know. So the combo of all of those has allowed me, I can speak personally, to really decrease the need for the narcotics as I've gotten several days out from surgery. I'm hardly having to use them.
Which is exactly, you know, the point of the regimen that we came up with. So that's awesome to hear.
Yeah, it's working well.
And so I hope people are listening, you know, the better you are about taking these the day before, taking them the morning of, and then the day after, getting on top of that at the beginning, then you can get off the narcotic stuff. And that's what typically keeps people from getting back to work and back to life, because you're nauseous. It becomes this cycle, and then you're really not on top of it. It's really made a big difference for those that have stayed on top of it. So I appreciate you bringing that up, Sarah.
Yeah. And I will say one other thing that y'all do really well is there was like 3 different things to help with nausea. And I did not have 1 ounce of nausea the whole time. So
it must have been your CRNA.
So congrats to y'all. That is obviously working very well. So I'm proud of that.
Awesome. It was so funny because she goes, "Oh, I get robbed the body instead of celebrity husband." She's like, "At least I'll have some sweet dreams." I was like, "We can't." I'm like, "We won't tell Dusty. We'll tell him you were already under anesthesia when you said that."
I'm like, y'all have to tell me if I said anything weird.
But maybe we'll tell you about the things you said offline, because I know this is a family
Perfect.
show.
Okay, deal. Sounds good.
Well, celebrity, anything else about anesthesia that we should touch on? Because we do some local anesthesia on the skin as well to try to decrease some of that pain in terms of the incision, even though the incision is a tiny little baby.
Yeah, it's a small incision to begin with, and then also you always put a little bit of local anesthetic at the skin. Another thing, I always talk to patients before we roll back and tell them, look, what you're going to experience after a breast augmentation, more than pain from an incision, is pressure and heaviness and tightness in your chest. And that's because we're putting something in a pocket that does not exist at the moment. We're going to create that pocket. Then we're going to stick an implant inside that pocket that's going to stretch. That stretch sensation manifests itself with pressure and a lot of tension in your chest. And that happens 99% of the time after a breast augmentation. Patients wake up, I definitely feel the pressure, not much pain, but it definitely feels like a little bit of pressure.
Yeah, absolutely.
And that's where playing with the different meds, I think, really helps, because some people do better with the muscle relaxant and anti-inflammatory than the true pain meds, because the pain meds don't really get rid of that tight pressure sensation to the same degree.
Absolutely.
Can we do a little something called Factor Fiction?
Let's do it.
Factor Fiction, you've never invited me on your new boat.
Well, that's fact, but I just got it out of the shop, so you got to give me a chance.
Factor Fiction, you and your trendy therapist have been rivals for a long time.
That's fiction. Mary and I haven't gotten to meet her in person, but I need to. Actually, I think the Austin bloggers are really good about working together, supporting each other. We're not rivals.
Fact or fiction, you don't even follow her.
I do follow her, I think. Okay, I'm not sure about that. I need to check.
We may have to fact check this fact or fiction.
I'm going to have to check on that. I have definitely Instagram stalked her, though, because of y'all's podcast.
So, but this is what I'm going to say. I'm not going to say it's a little weird or a little part to the rival, but it'd be interesting that you stalked her but don't follow her, because
I think I do follow her.
That's like G. Berta's girlfriend checking on all the exes. She'll check their Instagram,
She's
make
not
sure
gonna
they
follow
ain't
them.
mentioning G. Berto, but she ain't going to follow them.
Okay, well, you better believe I'm going to make sure I follow her right after this if I don't.
Fact or fiction, you have the world's greatest celebrity husband that does all your photos.
That's a fact.
Damn, the gauntlet has been thrown. The gauntlet has been thrown. Boom. Damn.
It's
He's
real
well-
now.
I'll say
Real.
that he's very well trained. He's been very well trained, so.
So could maybe celebrity anesthesia come train with you for a little while, and that way he can get his game up for Mary, or would that not go well in the rivalry?
Hey,
The
I'm here to help.
I'm
However I can help.
A celebrity husband boot camp.
Celebrity husband boot camp.
Sarah, you see, you could add a 5th job. You could start the celebrity husband boot camp.
Hey.
Damn.
Why not? Let's bring it on. Bring it on.
Let's do a little segment called Behind the Bovie. Maybe a little. What's a little nugget, Sarah, that you could tell us about your experience with breast dog that most people wouldn't know or think about? Is there anything that you can, a little nugget or something you can share that people wouldn't know?
Let's see. I'm trying to think.
If not, I'll jump in and help you.
Yeah, I don't know.
If-
Maybe that it's a really simple procedure. Like, I was really surprised that it took maybe an hour or less for the surgery and you go home within a couple hours. I was just pleased with
Just
like
because it doesn't take a long time doesn't mean it's not phenomenal.
Absolutely. That's not what I'm saying. But how about convenient? Like, it's just a pretty convenient thing. You don't have to be there all day. I'm happy that I didn't have to be under anesthesia very long, and you get to leave pretty quickly. So yeah, it's easy. But very effective way to change.
Efficient? Would you say efficient?
Efficient, absolutely.
You see, I've told you guys I'm efficient. I'm just efficient. You know what's another kind of golden nuggets in the terms of implants is I think most people don't realize that we try to never touch the implant. And so, it's in several boxes. So the nurses show me the box, and we'll have to video that process. It's actually kind of cool. So the nurses confirm the implant. They open that sealed box, and then inside the tech takes another sealed box that's reopened. And so they open up the third sealed box with the implant. We pour antibiotic solution, and then we actually dump the implant into the Keller funnel. And along with that, I changed my gloves. We already have the sterile field. We re-prep the skin, have sterile gloves on. I re-changed my gloves again, and before the implant, just to dump it into the funnel, and then it goes from the funnel straight in, and the funnel is used for the implant not to touch the skin. And so I don't think people realize how many extra steps we take, and that's after the pocket's been washed out with triple antibiotic solution, betadine solution, and a new thing we call phase 1, which is a anti-detergent from the inside, just all to prevent infection, prevent capsular contracture, and make sure that this easy process is all done efficiently.
Efficient,
Just a
not
breast
easy.
implant.
I knew about the funnel, but I didn't know about all the steps. So I think you should definitely record that. I think that'd be super interesting to watch.
Okay. Yeah, because I don't want people thinking that it's simple.
Okay. Okay, you're gonna give me a hard time about that. I'm sorry. Efficient.
Can we do a quote of the day since we smashed the sky's the limit and found out that there was footprints on the moon on the last episode?
I'm turning it over 100% to Gilberto on this one. I can't even compete anymore.
Sarah, did you know celebrity husband's favorite saying was always like, sky's the limit. And then on the last episode, which I'm sure you listened to, Gilberto comes in and says, how can the sky be the limit when there's footprints on the moon? I was like, damn, just like that.
I know,
Yeah.
just like that. My crown was gone.
Okay, I'm ready for this.
Any words of wisdom? A little quote of the day for us?
I got one. Yeah. Let's see here. Here's one from.
Oh, you just happen to have one. Boom, boom,
Just
boom.
happen
Wow.
to have one right here.
Here's one from Mahatma Gandhi. It says, live as if you were to die tomorrow. Learn as if you were to live forever.
That's a thinker. That's good.
Yeah, that's
like
a little
it.
bit more intense than footprints on the moon. I'm not gonna lie.
Well, it's just.
Can I say that that hits a little close to home just post COVID right now?
All right.
Gilberto's an intense man. Okay. Let's. Yeah, I'm gonna. I usually go
think on
around
it.
the room and ask what that means to everybody. Sarah, would you like to take that?
Sounds like I need to really do some learning. think on that. Like I'm gonna live forever. Absolutely.
Celebrity?
Would you say, Gilberto?
Oh, I was just gonna say. But go ahead. Go ahead.
No, I mean, I thought that was just saying, if you're given that opportunity to learn, you need to take it, and whatever you get out of something, use that for the rest of your life and use it to change your life for the better. Because if you could live forever, I mean, you're going to have all the time in the world to use it.
Yeah. I think for me, just taking it at face value, it's like, live as if you were to die tomorrow, take every advantage of life that you have, live for the moment essentially. But on the flip side of that, always keep learning, always keep striving, always keep working hard and grinding, and this,
Would you say sky's the limit?
No, I wouldn't, because there are footprints on
Of
the
course
moon.
not.
But I think this quarantine time has given a lot of people opportunities to take on new challenges and learn new things that they probably wouldn't have had the time to do otherwise. So it's just like, always be learning something new, just move forward.
I also think it makes you think about it and be like, all the dreams or things that you've said, hey, next year I'm going to go to college. Next year I'm going to apply for that new job. Next year I'm going to start that project. And I feel like, if anything, this quarantine, the COVID, the everything else that has happened this year, which has been an interesting year to say the least, I think pushes people like, hey, if you're going to make a change in your life, if you want to make a change in the world, like,
Why
do it
not
sooner
now?
rather than later.
Yeah,
you never know what tomorrow's going to hold, for sure. So I appreciate you. That's a great timed one. And so I know I'm giving you a hard time, but I think super, super important for people to think about. Any closing statements from anybody? Last thoughts around the horn? That's an ESPN reference. Sarah, just so you know.
Thanks for that. No, I don't know. I'm excited to keep y'all updated on the rest of my recovery. So you can, you mentioned earlier, but y'all can find me at Delivering Motherhood. I'm going to be sharing, I'm a week out. I'll share an update, and then we'll share, a month and then a few months so we can see the changes. But yeah, I'm excited to see where it goes from here.
So Sarah's Instagram handle is at Delivering Motherhood. She also has a website blog. So if you want to catch up on some of her past things, you can actually look her up. And her website is actually the same, at Delivering Motherhood, correct?
Yeah, deliveringmotherhood.com. That's it.
And it's a super cool, her Instagram does a little bit of everything. So she gives some shots of her as an OB nurse. She also sends a lot of stuff with her kids at the beach and so forth. And so kind of cool to just get caught up on what life's about. And I can't wait. So we're definitely going to make this happen. We're going to have the celebrity husband challenge off. And so Sarah and I will talk offline and don't want to give away all the nuggets I got in my head, because I want them to walk into the challenge unprepared. So maybe we can't involve Sarah. Maybe Gilberto and I got to come up with this, because I'm not going to say that Sarah will give her hubby a little bit of a unfair advantage, but I feel like there might be.
Okay, I get that.
It's on. It's on.
Third party, unbiased. We got to come up with these
Fair and balanced.
And I feel like Gilberto and I are pretty fair. We never get worked up. We never get out of control. So I'm sure this will be super reasonable challenges.
Totally.
Well, I want to thank everybody for listening to Plastic Surgery Untold, the greatest podcast in the world, as voted by us. I also want to thank producer Donald, who does all the back work, who unfortunately doesn't get seen on here because we're on Zoom. And so I am hoping, just so you guys know who are listening, hopefully within the next week or two, we will be in our new office. We are building out a new media room. So hopefully we will be in our new media lounge by our next taping. So that's my goal. That's my hope. I'll see you guys.
Exciting.
Thanks, everybody. Thanks, Sarah.
Thank you.
See you
Bye.
guys.
Bye.
Bye, Sarah.